Hello, good morning. My group member is I'm Zakira Mustafa and
I'm Wei Yiping.
today we present about mammography. First, description of the system. Mammography is actually a radiographic procedure which is specially designed for detecting breast pathology. Its process is using low energy X-ray and use doses of ionizing radiation which may create the image. It may use as diagnostic and screening tool. Actually, breast cancer screening programs rely on X-ray mammography because it is a low-cost, low-radiation dose procedure with the sensitivity to detect early-stage breast cancer. Approximately 1 woman in 8 will develop breast cancer over a lifetime. Mammography is recommended for all women more than 50 years old. It is actually quick and generally painless. The time taken for the procedure is less than 30 minutes. The value of mammography is early detection which may save life and save women's breast. Mammography also help to clarify whether a suspicious breast lump is a cyst or tumor. This is the picture of the tumor breast cancer. This is the picture of the mammography unit. Mammography unit is the rectangular box that houses the tube in which X-rays are produced. It is used exclusively for X-ray exam for the breast with special accessories that allow only the breast to be exposed to the X-ray. It is attached to the unique device that holds and compresses the breast and position it so that image can be obtained at different angles. During the mammography procedure, the preparation for this procedure, the patient should not wear deodorant, talcum powder or lotion under arms or breast on the day of examination since it will appear as calcium spot and may affect the film at the image we got later. Also describe any problems to the technologist performing the examination. Do not schedule for the week before period. This is because breasts usually tender during this time, and the best time for doing the mammography is 1 week following period, and the patient should inform doctor if any possibilities of pregnancy. The procedure of mammography is breast is compressed using a dedicated mammography unit. A parallel plate compression evens out the thickness of breast tissue to increase the image quality by reducing the thickness of tissue that X-ray must penetrate, decreasing the amount of scattered radiation, reducing the required radiation dose, and holding the breast still to prevent motion blur. And also then change position between image and rotating views top to bottom view and angle side view. Then the process is repeated for the other breast. The patient must hold very still and may ask to keep breathing for a few seconds while X-ray picture is taken. This is to reduce possibility of blur image. Technologists will walk behind a wall or into a next room to activate the X-ray machine, and after the examination, the patient will be asked to wait until the radiologist determine that all the necessary image has been obtained. Usually, the examination process takes about 30 minutes. There are some limitations of this procedure of mammography. First, not usually enough to determine the existence of a benign or malignant disease with certainty. Second, interpretation is very difficult because a normal breast can appear differently for each woman, and appearance of an image can be compromised if the powder or soft on the breast. There are some problems also with the results. First is false negative, which means that the missed cancer rates usually more than 10%. It is due to dense tissue obscuring the cancer, and appearance of cancer has a large overlap with the appearance of normal tissue.
Okay, next I will talk about the X-ray tube used in the mammography unit. First, the window of the X-ray tube is made of beryllium window and is a type of thin glasses window. For the cathode, it has dual filament in a focusing cap, and it has small focal spot size rather than if compared to the X-ray tube used by other procedure. And the small focal spot size can minimize the geometric blurring and maintain the spatial resolution. For the anode, it is rotating anode and made by molybdenum or rhodium, whereas most X-ray tubes use tungsten as the anode material. The molybdenum or rhodium is used because they can produce a characteristic radiation spectrum that is close to optimum for breast imaging. For the filter, is also made by molybdenum or rhodium to enhance the contrast sensitivity and to optimize the spectrum for specific breast condition. It can imagine larger or more dense breasts. For the focus spot, it has two selectable focus spots and is generally smaller compared to the other X-ray tube. For non-magnification is 0.3 to 0.4 mm, and for the function for magnification is 0.1 to 0.15 mm. It's used to minimal the geometric blurring and to provide a good visibility of details to see the small calcification, and is usually used for the magnification technique. For the uses for the compression is to reduce blurring from patient motion, reduce scatter radiation and improve contrast sensitivity, reduce radiation dose, and for the better visualization of tissue near the chest wall. As for the grid, it is used to absorb the scattered radiation in order to improve contrast sensitivity. The grid for mammography have a lower ratio and the material between the strip is selected for low X-ray absorption. The receptor for the mammography is single emulsion film. The usage of the machine. The mammography machine is used to detect and diagnose breast cancer, and usually it involves two views of each breast. It has two views. One is magnification views. Is used to amplify the image by using enlarged views to show a specific area in greater detail. A magnification view is especially useful in evaluating microcalcifications. For the spot compression is the technique that applies compression to a small area of the breast, creating better separation of the breast tissue. This technique makes abnormal appearing area easier to visualize and evaluate. The type of mammogram. First is the screening mammograms. Screening mammograms are done for women who have no symptom of breast cancer. It usually involves two X-rays of each breast. Screening mammograms can detect lumps or tumors that cannot be felt. They can also find microcalcification or tiny deposit of calcium in the breast, which sometimes means that breast cancer is present. Next is the diagnostic mammogram. Diagnostic mammograms are used to check for breast cancer after a lump of other symptoms of breast cancer has been found. Signs of breast cancer may include the pain or thickened skin on the breast. This type of mammogram also can be used to find out more about breast change. It can be used to view the breast tissue that is hard to see on a screening mammogram. A diagnostic mammogram takes longer than a screening mammogram because it involves more X-ray in order to obtain views of the breast from several angles. The technician can magnify a problem area to make a more detailed picture, which helps the doctor to make a correct diagnosis.
Next, I will explain about the differences of the mammography with conventional X-ray machine. The aspect is first the kVp range. For the mammography, the kVp range is 25 to 35 kVp, and for the conventional X-ray, the kVp range is varies. Then the tube target for mammo is molybdenum. For conventional X-ray is beryllium. The tube window for mammo and conventional X-ray are same, which use the beryllium. For the filter material, mammogram use molybdenum, and while the conventional X-ray use aluminium. For the filter size, the mammogram use filter of size 0.03 mm, where conventional X-ray is varies. The high value layer for mammogram is 0.3 to 0.27 mm of aluminum at 28 kVp. For conventional X-ray, it varies. For example, 1.5 mm of aluminium at 70 kVp. The focus spot size for mammogram is less than 0.5 mm for 65 SID, less and equals to 0.4 mm for 50 SID, less than 0.15 mm for 1.5 times magnification, and less and equal to 0.1 mm for 2.2 times magnification. And for conventional X-ray, the focus spot size is varies. The fine focus spot size is 0.5 mm, or broad is approximately approach to 1 mm. For the X-ray generator, the power rating for mammo is 3 to 10 kilowatt, and for the conventional X-ray it varies. Maximum is 4 kilowatt. The tube output for mammogram is 500 mR per second minimum at 28 kVp, and for conventional X-ray it varies. High voltage waveform for mammo is 3-phase or high frequency inverter type, while for the conventional X-ray it is use high frequency inverter type. kV selection for mammo is 25 to 35 kVp, which is accuracy plus minus 1 kVp, and for conventional X-ray it varies. Maximum is 60 kV. And lastly, time or MAS selection for mammo is 0.02 to 6 seconds, and also 2 to 100 millis MAS. For the conventional X-ray it varies. Maximum time or MAS selection is 170 MA. That's all from our group. Thank you.